You're taking the same flight of stairs you've effortlessly breezed up for the last 6 months. But today, your legs feel like dead weight. You stop every few steps just to catch your breath. What on earth is happening? For many people, this can happen after stopping GLP-1 medications like Ozempic, Mounjaro, or Wegovy. Today, I'll tell you what happens after stopping these medications and why the changes often go far beyond weight. Stick around because by the end, I'll show you why quitting a GLP-1 without a plan is one of the biggest mistakes people make and how you can avoid it. I'm Dr. Hanz, an internal medicine physician. I help busy people make sense of the science so they can make better health decisions and perform at their best. Whether you're leading a team at work or chasing your kids around after hours, this is information you don't want to miss. Let's get right into the 5 things that happen when you stop taking your GLP-1. Number 1. Digestion speeds up and cravings return. While you're on a GLP-1, your stomach empties more slowly and your appetite signals are dialed down. When you stop, digestion returns to its normal pace and those appetite signals come back online. For many people, the food noise returns and it can feel overwhelming. Hunger increases and cravings for high-calorie foods become much harder to ignore. Number 2. Rapid weight regain. Clinical data shows that many people regain a significant portion of their lost weight within a year after stopping GLP-1 medications. This is sometimes referred to as rebound weight gain. And if you've ever felt like a failure when weight comes back after dieting, you need to hear this clearly. It's not just about willpower. Your body is trying to defend its previous weight range. When the medication is removed, appetite and energy balance signals shift back, and weight regain becomes much more likely. It's not just discipline, it's biology and environment working together. Number 3, you lose the wrong kind of weight. Here's what many people don't realize. When you lose weight on GLP-1s like Mounjaro or Wegovy, you don't only lose fat, you also lose some lean muscle mass. When weight comes back after stopping, the body does not perfectly restore what was lost. With insufficient resistance training or protein intake, regained weight tends to be higher in fat relative to muscle, which can leave you with a higher body fat percentage than before. That's part of why everyday things like climbing stairs can suddenly feel much harder. Number 4, your health markers can shift back. Many of my patients love these drugs because their lab results suddenly look incredible. A lot of users feel great on GLP-1s because their metabolic markers improve. Blood sugar, blood pressure, and cholesterol often move in the right direction. But after stopping, those benefits may gradually slide back. This doesn't happen overnight, but over time, we can see metabolic risk factors returning, especially if lifestyle habits don't change alongside medication use. Think of the medication as support. It helps stabilize the system while it's active. Number 5, a wave of physical symptoms. Some people notice changes after stopping GLP-1s, such as fatigue, headaches, increased appetite, and feeling generally run down. In people with diabetes or prediabetes, stopping GLP-1 therapy can also contribute to rising blood sugar, which may lead to increased thirst, more frequent urination, and even blurry vision. These symptoms are more likely felt by patients with metabolic disorders when glucose control worsens, but some non-diabetics have reported experiencing them as well. So your energy tanks, your vision's a bit hazy, and the cravings are back. Is it hopeless? Absolutely not, but you need the final piece of the puzzle. You must follow an off-ramp protocol. The biggest mistake I mentioned earlier is stopping GLP-1 medications abruptly without a plan. Listen closely. You need a transition strategy designed with your doctor. Real-world evidence suggests that people who combine medication transition with consistent habits, higher protein intake, resistance training, and better sleep are far more likely to maintain their results. Because the goal isn't just weight loss, it's maintaining metabolic health long-term. The destination is a resilient life where pillars like a healthy diet and a consistent fitness routine become second nature. The bottom line, we need to shift how we view these medications. We have to start treating GLPs as powerful medical tools rather than permanent health crutches. GLP-1 is a bridge, not a destination. They give you a window to build the habits that keep your system stable even after the medication is gone. And if you're in your mid-30s and beyond, a busy professional balancing work, family, and energy demands, that stability matters more than ever. My goal is to help you build practical, easy-to-execute habits that actually fit into real life so you can maintain steady energy, sharper focus, and strong metabolic health without extreme routines. Ready to build a foundation that keeps you performing at your absolute best? Subscribe and check out my other videos. I'm Dr. Hanz. Stay sharp, strong, and spirited. See you in the next one.